Hi, I'm Katie Hengst. I'm one of the optometrists here at Enclave Vision Associates. The purpose of the video today is to discuss dual focus soft contact lenses as a method for myopia management. A dual focus contact lens is a soft lens worn by your child during the day that will correct their distance vision and also help to slow down the progression of their myopia. To understand how a dual focus contact lens works, we'll talk a little bit first about how a single focus contact lens corrects vision. A little anatomy lesson, we won't go into too much here, but just for demonstration purposes, here we have a side view of the eye. We've got our eyelashes here, cornea, this little clear surface is here. This is where light enters the eye. In a myopic or a nearsighted eye, when the light enters the eye, it comes to a focus not on the retina, where we have our photoreceptors, but a little bit in front of the retina. And because that image does not land directly on those photoreceptors, the image is blurred. When we prescribe a contact lens, we are essentially moving the image so that it lands directly on the photoreceptors, making it clear. When Dr. Montgomery and I prescribe a pair of glasses or contact lenses for someone, we have calculated what prescription is necessary to move the image so that it lands directly on a very special area of the retina called the fovea. The fovea has a very high density of photoreceptors, making it very sensitive to vision, and we want to make sure that everything there is very clear. But what we also know is that if we need, let's say, a -2 at the fovea, we actually don't need all of that strength in the peripheral part of the retina. We need less than that, maybe 175, maybe 150. But with a single focus contact lens, we don't have the ability to adjust that. If we prescribe someone a -2 so that they can see clearly at the fovea, that -2 is everywhere. It's at the periphery also, where we really don't need all of that prescription. What myopia management studies have shown us is that overcorrection of the periphery is one of the factors that increases a patient's prescription. It encourages the eye to elongate. So enter a dual focus contact lens. And a dual focus contact lens is just like what it sounds like. It is a lens with two areas of focus. The one that we use the most commonly here is called natural view, so this is its design. Natural view, the middle of the lens is set for the patient's distance prescription, giving nice crisp vision in the distance. But the outer edge of the lens, the periphery, is not as strong, so it's better adjusted for the peripheral parts of the retina where we don't want that overcorrection. Soft contact lenses are very safe, very effective. The dual focus design has been shown in many studies to help slow down the progression of myopia in children. Not everyone will be a candidate for this particular type of correction, so it's important to talk to your optometrist. And as always, let us know what questions you have.